Hi, I'm Dr. Pang.
Hi, Dr. Pang. I'm Judy. This is Matty.
Hi, Matty. Oh, you're adorable. Why don't you start first by telling me about Matty?
She's good. She's a puppy and she's active, but overall she's eating well. She's playing well. Her house training's going fairly good.
She's here for her second vaccines, and normally we have vaccines where we give the distemper parvo combo one that's 8, 12, and 16 weeks. So she's kind of an in-between. We're at 10 weeks right now, and she had her 6-week one. So we probably should go with 10, and we can even do 13 and then 16 weeks.
Okay.
Okay, just to make sure she's covered.
Okay.
Because she was pretty young when she had that other one.
Okay.
And just to make sure that she'll be protected.
Right.
Okay.
I have been keeping her only in our yard just because I wasn't sure how protected she would be.
Okay, good for you. And I think that's a good idea to do until she's fully vaccinated, including the rabies. And those are the core vaccines, the rabies and the distemper parvo combo. And we have a couple of other ones that we should probably discuss. So there's the Bordetella one, which is kennel cough. And that's important if she's going to be kenneled anywhere or going to puppy classes or even sometimes going to the dog park. There's so many dogs there. And the other one that we are concerned about is leptospirosis, and that can cause liver and kidney problems. As far as the exposure is concerned, she'd be exposed if she was around any wildlife or wildlife feces and urine, so especially raccoons and deer. And that is a 2-shot series. So if we gave it, we'd give the first one, and then 3 to 4 weeks later, we'd give the second one. You said she was doing well with house training. What are you doing for that?
Keeping track of her eating and knowing that she should go out after, I guess when she comes, she's in a crate. So as soon as she comes out of her crate, as soon as she wakes up, she goes outside. As soon as she does go, I praise her.
Okay, good. And how's her appetite?
It's pretty good. She doesn't actually stop and eat. Okay. Like she tends to nibble and run away and go back. So sometimes it makes it hard to judge when she should go out to the washroom because it's taken her half an hour of, eat, chase the cat, eat, run through the living room.
Okay.
So, and I was giving her, it's about 1/3 of a cup twice a day. Mm-hmm. What I started doing this week was breaking that 1/3 of a cup up into two morning and 2 afternoon feedings and mixing it with water. And she does seem to stay at the dish longer.
Yeah. And then when they've eaten those meals, it tells their body, I gotta go poop. And so you can do that easier than if they're just kind of grazing. Mm-hmm. Has she had any vomiting or diarrhea at all?
No.
Okay. Any coughing or sneezing?
She gets the hiccups.
She gets the hiccups, actually, yeah.
Because babies usually hiccup a lot, and so baby puppies, they do the same thing. It's very, very normal. And she'll grow out of it. And how are her bowel movements and urine?
Fine. Yeah, she doesn't seem to have any trouble. She has been dewormed too, but I didn't know if that was enough at that age or...
3 dewormings, okay, good. Yeah, we usually deworm once a month till they're about 6 months, but we also recommend doing heartworm preventative. Are you interested in having?
I guess she's okay at this age. I kind of thought she was too young.
We start in June. She'll be a little bit bigger by next month. Oh, okay. Because you'll have to come back anyway, so we can start the first one.
Okay. Yeah.
And probably what would be useful is you're right about bringing in the stool samples.
Okay.
And then as far as the nails, some of them are very, very sensitive with their feet. She's actually not too bad.
No, she doesn't mind playing.
But it's important if you could, when you're doing whatever with her, even if if you're just watching TV or whatever, and you're touching her everywhere, her ears, her mouth, because if she gets something that she shouldn't, and she doesn't want to give it to you, you should be able to tell her to drop it or be able to open her mouth to take it. Her tail, her back end. That way, if she ever gets injured or she gets something that she shouldn't, it's something in her feet, she'll let you know before you cut her nails. And always with reward. Good girl. Let's check you over, shall we? That ear looks nice. Look at those little needle sharp teeth. Oh, nice mouth. She's nice and pink. Teeth are nice. Lymph nodes are normal. And she's well hydrated, so that's good. And it looks like you've tried to clip her nails a little bit.
Yeah, I think this puts the...
So yeah, if you can just get the little tips
Okay.
Because you don't want to cut too short.
No,
and
and you
get
can kind of tell the sharp parts there.
Because then that'll upset her and it'll hurt.
And I guess her dew claws as well.
Mm-hmm.
She does seem to chew on them a bit, I guess.
Does she?
Well, she kind of chews her feet, but sometimes it's like she finds her dew claw.
Okay.
But
just keep an eye on that because that can, chewing their feet can be an indication of allergies.
oh, okay.
So,
It's okay. It's okay.
Oh, I know. I'm not hurting you. I'm just feeling your belly. Your pulses are good and her tummy feels normal. Now, what are your thoughts on spaying her?
Yeah, we're gonna get her spayed.
Get her
definitely,
spayed.
yes.
Okay. 6 months is usually the age that we recommend that they get spayed. Sweetie, I need to listen to your heart. Her heart sounds good.
Imagine that whining sounds pretty loud in that.
Okay. This part she might not like so much. I would like to take her temperature.
Oh.
So it might work best if you actually had, well, maybe like that. Just be careful she doesn't try to climb your shoulder. 38.2, so that's normal. So I'm going to give her vaccine, and I'm going to give it in her right shoulder. You do have to be aware that sometimes they can have vaccine reactions. The most common thing to see is lethargy. So she may be sleepy for 12, 24 hours, and sometimes a little inappetent. Okay, but that's pretty normal. Sometimes pain at the site of injection, so I'm going to give it here.
Okay.
So just make sure everybody in the family is aware that they, they may not want to really scratch really hard there.
Sure.
Sometimes they can get facial swelling, hives, vomiting or diarrhea. The worst is an anaphylactic type reaction, and that's more immediate.
Sure.
ICU is just next door, so you take her right in there.
And she has had, is this the same type of, is it the same things that she's had already? Okay.
Yeah. So, if you want to, let's see. I'm interested in this. It's huge. Pay attention to that while I do this.
That might work.
Good girl. Oh, girl, you want to hold it up for her so she's at least interested?
Girl.
This was the 10-week one, and then 3 weeks time,
Sure.
and then in 6 weeks time. So 10, 13, and 16 weeks.
Okay.
Caught up, and at 16 weeks we'll do the rabies. And just let us know if you're interested in the lepto.
Mm-hmm.
Here, how about I give you a little cuddle? Girl. Yes. Yes. See, you're okay.
She's fine.